Hi students, I am Dr. Ashraf Majrooh, Professor of Community Medicine. I welcome you in the learning session of Preventive Strategies and Intervention in Community Medicine and Public Health. The highlights of this session are the disease causation process, categories of public health problems, disease causation model, disease prevention models, steps for selection of appropriate model, and then we will discuss the behavioral model and its intervention, pathological model and its intervention, infectious disease model and its intervention. Let us start the highlights one by one. So first we will start with the disease causation process. It is now universally accepted that the disease is caused by multiple factors rather than a singular cause. Even if the disease is caused by germs, then it needs host agent and environmental factor for clinical expression in the human body. The etiological factor acts on the human body by number of ways, and these are known as the disease causation models. And the natural course of the disease falls in five steps. First, the underlying factors are interacting on the human body, and then there is a susceptibility phase. The human beings, they become susceptible to certain diseases, and then there is a disease expression in the form of subclinical phase, then clinical phase, and then stage of recovery or death. So this is the natural course of the disease, and the multifactorial theory of disease causation is now accepted rather than a singular cause. Let us see how the disease causation can be explained under various disease causation models. So the first of all, what are the categories of public health problems that cause the disease? The problems are grouped in pre-pathogenic phase and pathogenic phase. Let us see what happened, what factors they are acting in the pre-pathogenic phase. In pre-pathogenic phase, the health-related social factors, they are interacting, and this is the population dynamics, population composition, very important social factor. Then is the poverty and economic conditions of the population, and they are interrelated. More the population and the poverty and income is related to the population phenomena. Then social and health justice, these are the factors determining the acting in pre-pathogenic phase. Then health service provision, its availability, accessibility to the people, and equity in health services, they are acting. Then social norms, values, they are very important in disease perception and disease determination. Then social instability and wars are important factor in disease causation, natural calamities. All these are in pre-pathogenic phase. Then more factors related to environment are associated in pre-pathogenic phase. The housing, the water and sanitation, air, noise, and pollution, global warming and radiation, ozone depletion, deforestation, and industrialization. Then in pathogenic phase, definitely the diseases that these factors act, and specific syndromes, clinical expression of the disease occur, and this is in the form of communicable diseases like endemic diseases, malaria, measles, mumps, tuberculosis, HIV/AIDS, hepatitis, sexually transmitted diseases, epidemics like COVID-19, SARS, and Middle East respiratory syndrome and influenza. All these are the public health emergencies, which are the communicable diseases. The non-communicable diseases, cardiovascular diseases, cancers, diabetes mellitus, accident, chronic lung diseases, and these are all collectively now known as the slow modern epidemics. So these distinct groups, they are very important, and they usually expressed as a pathological phenomena, and they are falling in the pathological phase. Then certain risk factors are also occurring in pathological phase. These are the nutritional status of the individual and the community, lifestyles and behaviors, physical activity of the person, personal hygienes, smoking, drug addiction, and living standards. All these factors, they potentiate more specifically the non-communicable diseases as well as the communicable diseases. Now let us see and the disease causation models. Similarly, as already described, the models are related to pre-pathogenic and pathogenic phase. First is most important model in pre-pathogenic phase, described as the wheel causation model. The wheel causation model is very important. It shows the wheel, the hub of the wheel shows the genetic core of the human, and this is the genetic potential for the health and disease. Then this genetic potential is exposed to the social, biological, and physical environment, and the disease will be determined through the mutual interaction of the genetic potential and the social, biological, and environmental factors. This is a very important model. This model explains the disease from phenomena from the early age, even in the utero and in the early age, and then throughout the life. It also shows the relative contribution of these factors. For example, in genetic diseases like thalassemia, the core of the hub will be expanded, and the tire of the rim of the wheel will be shrunken, because most of the disease is determined by the genetically determined. So, the relative contribution of social, biological, social, and physical environment can also be explained in this disease causation model. The most important factors related to the social environment are the social status, customs, norms, population, genotypes, and social justice. And related to physical environment are the weather, water and sanitation, radiation and noise, air pollution, and atmosphere. Similarly, in biological environment, the bacteria, viruses, fungi, arthropods, animals, and foods and agriculture crops. They are plant kingdom is also related to the ecosystem for the health of the human beings. there should be harmony between these factors, and they will determine the healthy phenomena. And the other model, which is the infectious disease model, mostly it is commonly known as epidemiological triad. And this triad explained that the disease is caused by the mutual interaction of susceptible host, environment, and pathogens. And this is the disease area which indicates that these factors are synergistically effect to cause the disease, and the contribution from the host, the contribution from the environment, and there is contribution from the pathogens. The host factor which are determining the disease causation are the age, sex, race, genotype, behavior, nutrition, and immunity of the person. And on the agent side are from the pathogens, the infectivity of the pathogens, pathogenicity, virulence, immunogenicity, and antigenicity are the factors which are determining the disease causation. And in the environment, weather, housing, occupation, physical factor, microbes, pollutants, these will determine the disease causation. So in epidemiological triad, the infectious agent and the host and the environmental factor, they mutually interact, and they will participate in disease causation phenomena. Then next is the web causation model. In web causation model, there are multiple, this is the complex phenomena. It explained that the disease causation is a complex phenomena, and multiple factors act at a time on various diseases. For example, the tobacco use is linked with cardiovascular diseases, and it also linked with the cancer and chronic lung diseases. Similarly, the alcoholism is linked with the cancer. It is also linked with the cardiovascular diseases. High blood pressure is linked with the cardiovascular diseases, cancer, and chronic lung diseases. And high cholesterol level, high blood pressure, diet is linked with these chronic diseases. Sorry, uh, at a time. Similarly, the physical activity and obesity. So the web causation model explain most of the non-communicable diseases. So here we can, in these models, we can depict that we can depict that the wheel causation model mainly deals with the human interaction with the um, uh, genetic potential interaction with the human environment, and this is mainly explain the infectious diseases, and this is the model web causation model explain mainly the non-communicable diseases, and this is through the continuation of the natural course of the disease causation process. Now the prevention models, as we have discussed the causation model, the prevention model can also be explained in pre-pathogenic and pathogenic phase. The prevention models, the most important model, which is known as behavioral model, it is actually the primordial interventions. The primordial interventions start from very early life, and they include the health promotion, health protection, and health prevention interventions. And then this will continue the primordial prevention in pathological model where the wheel or web causation models are fitting, and they include the primary prevention, secondary and tertiary prevention. And this model starts with the even in the pre-pathogenic phase, and it moves to the pathogenic process. So the pathological model start from the pre-pathogenic phase. It covers both pre-pathogenic and pathogenic phase. Then the prevention model, and these are two linked as the primordial prevention, then will continue in primary prevention, secondary and tertiary prevention. And the infectious model of prevention, it is based on epidemiological triad, and the strategy in this is the attack at the reservoir or the source. First, the disease is curtailed at the point of reservoirs and sources, and then there is the interruption of route of transmission. And if this is the second barrier, and lastly, the host defense is the option for the disease prevention. So these prevention models will be used where they are appropriate, mostly the infectious diseases, and these are most appropriate for the non-communicable diseases. And this model is mainly in a pre-pathogenic phase as a primordial prevention. Now, what are the steps for selection of preventive strategies? And there are three steps: knowing the disease profile and categorizing the disease problem or health related issue, and then selection of suitable approach. In knowing the disease profile, we have to do the desk review of the data or the information available about a particular problem or disease, and then fresh data may also be required, and we do the situational analysis and set the goal whether we want to control, eliminate or eradicate the problem under consideration. Then we categorize whether this problem is definitely a disease, communicable or non-communicable, whether it is a factor or it is a underlying cause like environmental and social factors. So the strategies will be based on this categorization. When this categorization is done, then we will choose the model for communicable diseases, non-communicable diseases, and underlying factors. So this is the step, and important is to know the data, and then categorizing the problems, and then selection of model. And then selection of appropriate model include: in developing countries, there is a double burden of disease, and both communicable and non-communicable diseases are prevailing, and they are posing the public health concerns. So, in first question to ask is the disease communicable? And if the answer is yes, then definitely the infectious disease model will be appropriate for the short incubation period and short infectious period. The diseases with short incubation period and short infectious period will not allow the secondary prevention. That is why the pathological model is not working here. The infectious disease model will be selected. The examples are COVID-19, dengue hemorrhagic fever, SARS, MERS, polio, measles, mumps and rubella, and rabies. And these are the examples where we use the infectious disease model for prevention. And then, on the other hand, if the Non-communicable slow modern epidemics are there. If the disease is not communicable, then pathological model is the choice, and it will focus on the non-communicable diseases like coronary heart disease, hypertension, diabetes, cancer, and accidents. Um, then underlying these diseases are the factors, as it has already explained. Then behavioral model for the public health problem, and that is mainly explained on the basis of field causation model like smoking and accidents, nutrition and sanitation, global warming, and air pollution. This is because the behavioral model behavior is not only the behavior of the individuals, it is also the behavior of the communities that determine these factors. So the behavioral model is used for these sort of problem, which are the underlying causes. Now, it should be remembered that all these strategic models are applicable to each public health problem, but the feasibility and appropriateness varies by nature of the public health problems. The pathological model based on natural course of the disease is applicable to non-communicable diseases, but it is least suitable for the communicable or infectious diseases. On the other hand, the infectious disease model is logically suitable for communicable diseases and it is least suitable for non-communicable diseases. Similarly, as it has already been explained, it should be remembered that the behavioral model is the primordial prevention for each model, and it is generally more appropriate for the risk factor and underlying causes of the disease like environmental degradation. So the majority of intervention in each model are common, but their sequence is changed in every model. No watertight boundaries can be drawn in the models and interventions. The example of this changing intervention is that in infectious disease model, the host defense immunization intervention is the host defense strategy, which is falling at the last part of the host in the host defense, last event, last in the last of the model. On the other hand, in pathological model, the immunization falls in the specific protection in the primary level of prevention. So this is how these interventions, their sequence is changing. Now we will describe the behavioral model. And the behavioral model consists of three major intervention. One is the health promotion, and it is the based on the voluntary behavior of the individuals and the community. And then is the health protection. It is the enforced behavior, which is through the legislation and the government policies. Then prevention is through the action taken through the health professionals. So what we do in health promotion, the health education, awareness and advocacy of the consumers and the healthcare providers, and this is based on the informed choices. In this intervention, the community is informed about the good and bads of things, and then they have the choice. And then counseling and motivation is the intervention in related to the health promotion, promotion of personal hygiene, conducive behavior for health. So the ultimate objective is through health promotion, the people should have the control over the behavior, which is conducive for health. In health protection, mainly the legislation and regulation are involved, and Air and Water Quality Monitoring Acts, and monitoring of the water samples, health and social insurance regulations, environmental protection laws, and food security laws. All these are the intervention in health protection. That mean all these behavior where the communities are not voluntarily adopting through informed choices, then they are enforced to do the desired behavior to protect the health of the other people. In preventive action, and there is a medical screening, immunization, chemoprophylaxis, safety, setting safety standards, nutritional counseling and nutritional monitoring, maternity and child health care, family planning. All these activities, technically, they are preventive action related to the provided by the healthcare providers. So, in behavioral model, these factors, they are these interventions, they are used for prevention of the underlying problem and the diseases. In what are the application of behavioral model? The behavioral model is used in drug addiction and smoking, accident and injuries, mental disorders, obesity and hypertension, environmental degradation, air pollution, global warming and radiation, occupational health, cancers, and sexually transmitted diseases. Then application of example of application of behavioral model on occupational health. In occupational health, the health promotion actions are and for voluntary choices, the advocacy of stakeholders, awareness of the worker, workplace health education, personal protection, and personal protection equipment. Then occupational legislation, labor laws, social security, and insurances in health protection. Similarly, in screening and treatment, periodic medical examination, immunization, and permissible exposure levels, adjustment and time-weighted average exposures setting, physical worker capacity estimation, and use of biomechanics. This is the application of behavioral model on the occupational diseases. The pathological model is based on natural course of disease. This is very important to explain. And the model consists of the stage of susceptibility, stage of subclinical disease, stage of clinical disease, and stage of disease recovery, disability, or death. This is the pathological stages, and this is the pre-pathogenic phase. The pathological model start even in the pre-pathogenic phase. And uh, there is a exposure here, and pathological changes occur here, and the onset of the symptoms, and this is the usual time of diagnosis. So this is the pathological phase, and these are the underlying factors. Here we introduce the primordial prevention and through behavioral model, and this is the primary prevention in in stage of susceptibility, and this is the time for screening where we use the secondary prevention, and this is the tertiary prevention where the disability limitation and rehabilitation is introduced. So this is the pathological model here, and this is the behavioral model here for the underlying factors. So what are the intervention in pathological model? And the interventions are the primary prevention. This is the prevention of disease before its occurrence, and health promotion specific protection are strategies, and the target population is the mass population or high risk target groups and subgroups of the community in this intervention. The second intervention mode of intervention is the secondary prevention, the screening and in early pathogenic phase, and the screening and early intervention. High risk, the target is high risk groups in pre-pathogenic stage of illness. Disability limitation is the action taken in tertiary prevention, disability limitation and rehabilitation. This is in late pathogenic phase for restoration of functions and social adjustment through rehabilitation. So this is in clinical spectrum. This is in free when the person is free from sickness. The primary prevention is introduced. In unrecognized sickness, the secondary prevention is used, and in advanced clinical phase, the tertiary prevention through disability limitation and rehabilitation is used. The objective of all these intervention is improvement of health. This action will lead to improvement of health, and these actions will lead to restoration of health. Then here is the demarcation between the pathogenic and pre-pathogenic phase, as it has already been explained. And this intervention falls the primary prevention in pre-pathogenic phase, and the objective is a spectrum in the health spectrum. It leads towards positive health, and this is the pathogenic phase of the spectrum, and these two intervention fall in pathogenic phase. So this is and the then what is the feasibility criteria? Disease may have long latent period or incubation period, and it should provide sufficient screening time in asymptomatic phase. So this is the most important factor to select this model for prevention. Coronary heart disease, cervical cancer, pneumoconiosis are suitable for this along with other diseases, and there must also be other criteria, the treatment or intervention to revert and the disease in pre-pathogenic phase must be available. Then the screening test, appropriate screening test in asymptomatic phase must be available. So these are the criteria for selection of and the pathological model. The pathological model is applied in cardiovascular diseases, obesity and hypertension, diabetes mellitus, cancer, chronic lung diseases, accidents and injuries, pneumoconiosis. So this is the application of pathological model. Then most important is the infectious disease model, which is based on interruption of chain of transmission. Then what is the chain of transmission? The chain of transmission consists of the reservoir, the mode of transmission, and susceptible host. The reservoir are the infected persons. They are the patients and carrier, incubatory carriers, contacts, convalescent carriers, asymptomatic carriers. The mode of transmissions are the direct contact and the droplet infections, the airborne, the vector-borne, and fecal-oral transmission and transplacental, also through the animal transmission. So all these are the modes of transmission in this loop, and the last loop is the susceptible person, and the age and gender, the race and ethnicity, low immunity, comorbidity, vulnerable subgroups. So these factors render them as susceptible person. So in preventive strategies, out of these three loops, one of the loop have to be targeted, or all the loops can be targeted where they are feasible in the chain of transmission. Now, how this chain of transmission is break, where to put the barriers, either in at reservoir or mode of transmission or susceptible host. Here we can put the barrier at the reservoirs. The intervention in the reservoir are case finding and treatment, isolation, quarantine, disposable of animal reservoirs. At this point, in the route of transmission or the mode of transmission, here we can put the barrier, and these barriers are social distancing, personal hygiene, hand washing, vector control, safe sanitation, and safe food and water. So these are the intervention at the interruption of route of transmission. If these barriers are not being implemented, the other option at this susceptible level is to increase the immunity through balanced diet, through use of vitamins, and vaccination, immunization, and chemoprophylaxis and personal hygiene. So this is the body defense. This is how this chain of transmission can be interrupted, and this is most important used in these days. And then the same model is used for dealing with the pandemic COVID-19, which is currently a public health calamity all over the world, and it is great threat to the humanity. The diseases in which all the model can be applied, and there is, as I have already talked, that there is no clear cut demarcation. Some diseases like sexually transmitted diseases, we can apply all the models. Similarly, hepatitis B and C, HIV/AIDS, in these diseases we can apply all the models. Then summary and conclusion. For underlying health related factors or risk factors, the behavioral model for primordial prevention is the most suitable strategy. For communicable diseases, infectious disease model is most suitable strategy for prevention. And for non-communicable diseases, pathological model based on the natural course of disease is most suitable strategies. Thank you for listening.